Dr. Tasman Cordie with Sage Nutrition. If you have a food sensitivity, that's quite different from a food allergy. Food allergies are something that happen very immediately after you touch or taste or swallow a food. It's something that you probably need Benadryl or an EpiPen or even need to go to the emergency room for. It's usually scary, it's usually uncomfortable, and you want to do everything you can to avoid that food or substance, probably for a really long time and usually for the rest of your life. Oftentimes that anaphylactic kind of response isn't something that gets better with time. Food sensitivities, on the other hand, can get better and can go away with avoidance and moderation. We test food sensitivities using a little blood spot test. We test about 100 different food sensitivities in my practice. And when we do that, the reason we test the blood and the reason we look at these immunoglobulins is because food sensitivities are difficult to put your finger on. You don't get a huge response immediately when you put something in your mouth. Over the course of up to 5 days after you ingest something, that's when you'll have some kind of response, and it might not be huge. It might be a migraine headache 3 days after you eat something that you're sensitive to. Or it might be a digestive problem a few days after you eat something that you're sensitive to. So they're hard to figure out because it would be a matter of eliminating so many things, and some people are allergic to very normal foods like pineapples or garlic or apples. And so to figure out what you're sensitive to, we do a blood spot test, take a look at about 100 different foods, and then figure out from there what you should avoid for a certain amount of time. Usually people need to avoid foods for 3 to 6 months, sometimes longer, depending on the gut health, depending on the overall health of the system, and then depending on how significant or severe the food sensitivities are. So the general difference is that food allergies, again, are an immediate response. It's an immunoglobulin E response. And if you remember E for emergency, that's a good way to think about that. But a sensitivity is an immunoglobulin G response. So that one's the response that happens over time. They're in different ways both detrimental to the system. They both need to be handled well to keep your health and regain your health and recover your health. But the immunoglobulin G response is not as scary typically as the immunoglobulin E response that requires some kind of emergency effort or some kind of emergency response almost always. If you have any questions about this, let us know. Give us a call. If you want your food sensitivities tested, give us a call. We'll do a free consult and get you in.